Bipolar disorder versus borderline personality disorder. What's the difference? That's what I'm going to talk about today. This question is based on a viewer submission. Montana wrote in and asked, "Can you explain the difference between a borderline with depression and bipolar?" I'm going to focus on the difference between bipolar disorder and borderline personality disorder because depression is already part of bipolar disorder. There's a big distinction between personality disorders and psychiatric illnesses like depression, anxiety, schizophrenia, or bipolar disorder. Personality is more like your hardwiring, your enduring traits, while illnesses are more like your state at a given time. Here's another way to think about it. Your personality is like the climate of a region. A psychiatric illness, like depression, is more like the weather happening in that climate. For example, I grew up in Florida, which has a warm climate. We basically had 2 seasons, hot and not quite as hot. But then hurricanes would rip through and completely disrupt everything. Once hurricane season passed, though, the climate remained warm. In the same way, your personality makeup, your climate affects how your illness, the weather, shows up. Take Russia, for example. It has a very cold climate. That climate shapes the storms you see there. You get blizzards instead of sandstorms. In deserts, you see dust storms. In the tropics, you get tropical storms. So, if a person with narcissistic personality disorder gets depressed, it looks different from someone with dependent personality disorder who gets depressed. The narcissistic person, because of their self-centeredness, may look more angry or self-loathing. The dependent person, because of their neediness, may appear more pitiful and helpless when depressed. Now, these are just broad examples, but it helps to illustrate how personality influences the way illness manifests. Let's circle back to borderline personality disorder, BPD. This is a huge topic, but I'll keep it brief here. I'm going to use the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders 5th edition, for the definition. Borderline personality disorder is defined as a pattern of unstable relationships, unstable self-image, and unstable emotional expression, marked by impulsivity, beginning in early adulthood and present in a variety of contexts, as indicated by 5 or more of the following criteria. Now, it's really important to understand this. It requires 5 or more characteristics. Having just 1 or 2 doesn't mean you have borderline personality disorder. Here are a few of the core features. 1. Frantic efforts to avoid real or imagined abandonment. For example, someone with BPD might read into things too easily. Something you say could be interpreted as rejection or abandonment, even if that wasn't your intent. 2. A pattern of unstable and intense relationships. This is often characterized by swinging between extremes of idealization and devaluation. So, at one point, the person may think you're the best thing that's ever happened to them. You can do no wrong. But the next day, or even the next hour, they may flip and see you as the worst person ever. 3. Identity disturbance. This is a markedly unstable sense of self. And we're not talking about normal uncertainty like, should I be a teacher or an astronaut? This is a deep confusion about core identity issues, like gender, sexuality, or even spirituality. Now, I want to tiptoe around this point carefully because I don't want you walking away thinking that anyone who wants to change their gender automatically has borderline personality disorder. That's not the case. As I mentioned earlier, the diagnosis is based on a grouping of symptoms, not just one. You need at least 5 or more of the traits I'm listing, and they need to be causing problems in multiple areas of life. It's not about a single behavior. For example, just being angry doesn't mean you have borderline personality disorder. Cutting yourself once doesn't automatically mean you're borderline. It's about a pattern, multiple traits, showing up in different areas of your life, and interfering with relationships, work, and well-being. Let's continue with the diagnostic criteria. 4. Impulsivity in at least 2 areas that are potentially self-damaging. Some examples of this include reckless spending, risky sexual behavior, drug or alcohol abuse, or binge eating. 5. Recurrent suicidal behavior, gestures, threats, or self-mutilating behavior. This might look like cutting yourself or taking overdoses of pills, not necessarily because you want to die, but as a way to cope with overwhelming internal distress. 6. Unstable reactive mood. This involves sudden shifts in mood, like episodes of sadness, irritability, or anxiety that usually last just a few hours or maybe a couple of days. This is actually one of the key differences between borderline personality disorder and bipolar disorder. I'll explain more about that distinction after we finish the full list. 7. Chronic feelings of emptiness. This is one of the most painful features of borderline personality disorder. Some people with BPD cut themselves as a way to feel real again or to relieve that deep sense of emptiness and tension. 8. Intense, inappropriate anger or difficulty controlling anger. This might look like temper tantrums, constant irritability, or even physical fights. 9. Transient, stress-related paranoid thoughts or severe dissociative symptoms. Clinicians sometimes call these micropsychotic episodes. They're not full-blown psychosis, but they come close. If you don't know what psychosis is, let me know. I'll make a full video where I explain it. But let me pause here and explain dissociation, since it's part of this symptom cluster. Dissociation happens when a person disconnects from their present situation. This disconnection can be from the environment around them, from their thoughts, or even from their sense of self. For example, someone who has been subjected to repeated physical or sexual abuse might cope with the trauma by mentally pulling away, almost as if the abuse isn't really happening to them. This kind of mental escape is a survival strategy that helps them get through the experience. With borderline personality disorder, dissociation can happen in many different circumstances, not just extreme trauma. So, those are the criteria for borderline personality disorder. And as you can see, it's a lot. That's why it's not enough to look at just one behavior and say, I must be borderline because I cut myself. To meet the diagnosis, you need to have at least 5 out of the 9 features I listed showing up in your life in an ongoing way. Now let's compare borderline personality disorder with bipolar disorder. At first glance, they can look very similar. Both can involve mood swings and impulsivity. But the timing and pattern of those mood changes is one of the biggest differences. In borderline personality disorder, mood shifts can happen hour to hour or several times throughout a single day. In bipolar disorder, the episodes last much longer. By definition, a depressive episode needs to last at least 2 weeks, and a manic episode needs to last at least 1 week. So you don't see people shifting from depression to mania and back again within hours. Another difference is in the core issues. The fear of abandonment and unstable identity seen in borderline personality disorder are tied more to your personality hardwiring and your environment, how you were shaped in your formative years. These issues are not part of bipolar disorder. This touches on the old nature versus nurture debate. How much of who you are is based on genetics, and how much is based on the environment you grew up in? Personality disorders sit at that intersection. So here's a way to picture it. Think of mania and bipolar disorder like a hurricane that sweeps in, wreaks havoc, and then passes. The underlying climate, your personality, remains the same after the storm. Some other practical cases are worth pointing out. For example, bipolar disorder itself does not make a person engage in manipulative behaviors. Manipulation is connected more to personality traits, not mood states. Also, when someone is manic or depressed, self-harm isn't automatically caused by that mood state alone. If a person who is depressed turns to self-harm, it's often their personality and coping style that drives the behavior, not just the depression itself. In other words, depression can increase the distress, but how you respond to that distress depends on your underlying coping mechanisms. Now, let's talk about treatment, because this is another major difference between borderline personality disorder and bipolar disorder. The primary treatment for borderline personality disorder, BPD, is a specialized psychotherapy called dialectical behavioral therapy, DBT. DBT is an offshoot of cognitive behavioral therapy, CBT, that was developed specifically for BPD. When it's delivered by a trained professional, it's highly effective. DBT usually combines both individual sessions and group sessions, focusing on skills like emotional regulation, distress tolerance, mindfulness, and building healthy relationships. The primary treatment for bipolar disorder, on the other hand, is medication management. While mild to moderate depressive episodes can sometimes improve with CBT, manic episodes usually require medication such as mood stabilizers, antipsychotics, or a combination. Here's where things can get complicated. A person can have both disorders. For example, someone with borderline personality disorder can also experience major depression. In that case, they may need medication for the depression while also doing DBT for the personality disorder. Even without bipolar disorder, People with borderline personality disorder often experience intense mood swings or anger. Sometimes, mood stabilizers are prescribed to help manage those symptoms. That doesn't automatically mean they have bipolar disorder. It just means the medication is being used to treat mood instability that comes with BPD. And yes, this overlap can get confusing. That's why the best treatment plan should always be determined by a qualified clinician who has evaluated the person thoroughly. Here's the main takeaway. Bipolar disorder tends to be episodic, like unpredictable storms that come and go. Borderline personality disorder involves a more consistent set of behaviors and feelings that fluctuate in intensity but remain part of daily life over the long term. That wraps up this topic. Thanks so much for watching. If you know someone who could benefit from this video, please share it with them and feel free to drop me a comment, even if it's just to say hello. See you next time.